Here's today's question for you. Are you making it easy for prospective patients to say yes to you in your practice? Are you presenting your value proposition in a way that has your prospects salivating to initiate care with you and gladly evangelize your amazingness to everyone that wants to listen? Or are you secretly sabotaging consumer confidence into you and your practice? Hi, Iserloh here, and in this video we're going to talk about the 4 things to boost consumer confidence into you and your brand, so it's easier to get people started on care, so people don't step on the brakes and second guess their decision to work with you. And if you want to go even deeper on this, be sure to click on the link below this video with additional resources to help you boost consumer confidence on your social media, your website, and your email marketing. Now, if you haven't yet subscribed to my YouTube channel, please do so now, and don't forget to hit the bell to be notified every time a new video goes live. Alright, let's talk about why patients are typically gun-shy to make a decision before we turn our attention to the 4 areas where you can instill more confidence. So firstly, there is the cumulative impact of all the past providers that they have worked with. So when they come to you, it's probably safe to say that all the other providers that they have worked with have not been able to give them root cause resolution, right? Otherwise, they wouldn't be looking for yet another practitioner. So when they show up on your doorsteps, it's very natural that they're very skeptical about your capabilities to actually make a difference. Why are you different? You know, why should they trust you? And so that's what's riding in the back of their mind. Number 2, they're thinking about their significant others and their family that probably are rolling their eyes, and the family are wondering and second guessing their decision to yet swap horses again and find yet another practitioner to work with. And so there's significant financial and emotional risk attached to a prospect seeking another provider and investigating working with you. And then finally, there's the thought of sunk costs. So they may have invested a lot of resources already, and so now they may be gun-shy to throw good money after bad money, right? And so that is another thing that you have to overcome. And typically when patients come to you, their financial resources are already depleted. And I know how annoying that is when you can clearly see what the resolution is, how you would go about this, and you wished that patient had come to see you years earlier, before they had spent all the money, before they had worked with all these other providers. But the reality is, here we are, and this is the stuff that you have to address as a practitioner in order to have a shot at working with that patient. Now, let's look at the 4 areas of where you could impact their confidence level in you. Well, number 1, you have to clearly articulate your USP. And USP stands for unique selling proposition, that which makes you unique. And what you have to realize is that for prospects to even perceive that they have an alternative, they have to first understand that you're unique, that you're different from all the other providers that they have previously worked with, right? Because otherwise, why would they ditch their current provider and work with you instead? And in this context, it's important to talk about the unique mechanism of the problem. You have a much better chance to convince people to work with you if they first understand why they are still sick. Why have all these other providers not been able to achieve root cause resolution for them? And you may want to point out the flaws in their thinking, why they're going about health restoration the wrong way. So maybe it could be about pointing out that they're applying the principles of acute care in a chronic disease paradigm, where it's not about taking a pill to get to root cause resolution, that you have to instead do lifestyle changes. And so pointing this out will then allow the prospects to see, that's the reason why all these doctors have never been able to help me. Which then brings me to the next point, which is the unique mechanism of your solution. So for prospects to see that your process is actually the smarter way to address it, they have to understand how it's different. So this is where, as an integrative naturopathic or functional medicine provider, you want to talk about lifestyle medicine. You want to talk about root cause resolution. You want to talk about the flaws of that it's not just one pill to address a certain condition, but that it's lifestyle changes, right? And talk about your unique process in your practice, how you go from initial discovery call to the initial intake to the lifestyle visit to the lab reviews, etc. You talk about the lab testing that you do, right? So the unique mechanism of the solution is your proprietary way to get them to the desired health destination that they want to go. And because you have a process, because you have a method to follow, there's more confidence that you actually can get them. You don't want to come across as somebody that's just making things up on the fly in terms of treatments. Oh, let's try this, or let's try this, or let's try this. They've already seen this from the other providers, and so they want to have somebody with a plan and that's confident about their plan. Which brings me to point number 2. You have to have a signature program. Now, the thing is about signature program that when you name your proprietary process, which could be exactly the same as the practice down the road, but when you name it, you claim it. And when there's a named process, it instills more confidence from the prospect that this is actually a proven solution. That's what you do with each and every patient. And because there's a named process and because you have taken the time to really think through what the framework is, there's automatically more confidence relative to a practitioner that just says, hey, we're going to customize the treatment to you. We're going to figure out a 1 in a million solution. Your patient doesn't want to be a 1 in a million guinea pig having you figure out what to do. They want to know that you have a treatment process, that they just are a cog in the wheel, and that if they do the work and if we do the lab testing, if we do the lifestyle intervention, that they will get the outcome that you've gotten for all your other clients. Now, number 3 is actually patient testimonials. So obviously another confidence booster for your clinic and your services is really that if you have social proof from other people that have gone through your process and that have gotten the desired results, and that your prospective patients see themselves in those patient testimonials. They can see these people are exactly like me, and because they're exactly like me and they have gotten the outcome that I want, I can be more assured that this doctor will be able to get me the desired health outcome. And the 4th point to instill more confidence in you and your services is consistency. In your prospect's eyes, consistency equals safety. And here's what I mean by that. In today's world, people have been disappointed by solution providers so many times. It's actually the exception if somebody actually does what they promise, if they do as they say, and stay true to their word. And so if you are consistent in your actions, if you are consistent in how you present yourself, if you are consistent in your messaging, what you say, if you are consistent in your branding, how you look on social media, how you look on your website, how you look in your emails, how you look in your practice, if all of this is consistent, that engenders trust among your audience because they see that this person has really thought this through. They have made the investment in branding, into messaging, into being consistent, in having consistent social media efforts, that they're not going to go away. They're a safe bet. And so that's what you want to strive for as well, that you show them that there's consistency in everything that you do, that you have a consistent focus on details. So there's attention to detail in your social media, on your website, in your email marketing, in your clinical services. There's an attention to detail. And so again, that consistency really engenders a lot of trust, and people oftentimes don't want to necessarily work with the best. They much rather work with somebody that's dependable and actually delivers on what they promise, even if it takes a little bit longer. And so I think that is encouraging news for all of you, because that is definitely attainable. And I know that all of you are amazing clinicians. So if you pair consistency with your amazing clinical skills, then you have the best of both worlds. All right, so to recap, when you clearly and consistently articulate your USP, when you follow a proprietary signature process, when you showcase client testimonials, speaking to remarkable experiences in your practice, and when you stay consistent with your message, with your branding and your marketing, then it's much easier to enroll new patients into care because you are considered a safe bet. Now, if you like this video and you want to go deeper on this, be sure to click the link below this video where you have my checklist with your USP and a unique mechanism of the problem and solution, as well as several other tools to help you boost the confidence in your social media and on your website. If you want to explore what it looks like working with our team at Big Boost Marketing on your USP, on your marketing, then apply for one of our free strategy sessions as well. And if you like this video, please comment, like, tag a friend that needs to hear this. And if you are not yet subscribed to our YouTube channel, be sure to hit the subscribe button and check the bell to be notified every time a new video goes live. I'll see you in the next video.